Go.
Hi, we're Team 7. I'm Meredith.
I'm Marissa.
I'm Amanda.
And I'm Olivia.
And today we're going to be talking about redesigning dental implants.
Tooth loss is very prevalent in the United States, with over 35 million people having total tooth loss in one or both jaws. Tooth loss is typically caused by bacterial infection that can be detrimental to the patient's quality of life. In addition to this, tooth loss can be caused by accidents in which something hits the face or hits the jaw, causing teeth to fall out. So what exists on the market today is a titanium screw, as seen in the picture. The titanium screw has three parts, which is the titanium screw itself, which is the part that goes into the jaw, the abutment, which is under the crown, and the crown itself, which looks like a normal tooth. So the most common mode of failure for these screws is infection, which causes bone deterioration in the jaw. Also, if you have poor dental care, it causes increased risk of infection because the implant isn't being taken care of to its fullest potential, therefore causing bone deterioration in the jaw. And this can have an effect on the surrounding tissue and surrounding teeth, and this is called mucotis. So our group saw a need for a coating on the titanium screw that would promote osseointegration and to minimize infection.
Our team is going to be focusing on redesigning the already existing titanium screw as shown in the picture on the right. First, we're going to modify the titanium screw. It already promotes osseointegration and there's no cytotoxicity, so it'll be a good base layer for our implant. Next, we're going to add a titanium foam coating, which there will be no rates of galvanic corrosion because it's like metal on metal. Then it will also increase the porous structure and volume and surface area to allow more room for bone growth. Next, we're going to add a hydroxyapatite coating, which is already found in bone, so it will be biocompatible. It also will accelerate bone growth and add higher mechanical strength to our implant design.
In order to do this, we chose to use model animals, and specifically we chose goats, and there's a few different reasons for this. First off, they have less critical public perception, so the people aren't as opposed to us using them for studies, as well as they have a distributed diversion system, and that they are large enough that they are suitable for multiple implants per site. So this allows us to use less actual model animals. And then as seen on the table on the bottom, they have a similar area of the jawbone, so this allows just for better testing, and they also have other similarities to humans, such like the microanatomical composition, as well as the mineral composition and the metabolic and bone remodeling rates. And then to test the viability of our design, we wanted to overall make sure that it met all the FDA requirements, and also we wanted to analyze the osseointegration and analyze the bone ingrowth depth. So in order to do this, we chose to look at histomorphometry, ESCA, microtomography, as well as different corrosion and biocompatibility testing.
So the benefits of dental implants as of right now are that they are longer lasting than other implants or other dental procedures. The TI foam that we're implementing on our screw is porous, which allows for 97.7% bone filling 2 weeks post-implementation, and the increased surface area gives better osseointegration to the implant itself. It also does not damage adjacent teeth and prevents teeth from shifting when there's a space in the jaw. In addition, the average cost is $5,800 in the US, including the screw itself, the procedure, but not other medical needs with the procedure. Insurance sometimes covers the procedure, and the American Academy of Implant Dentistry could provide future funding for implants. So currently there are 2 types of implants on the market: a 2-stage implant where it's implanted into the jaw, and then the abutment is implanted in a second surgical procedure, and this is endoseal in place of a bridge or a denture. And then the single-stage implant requires 1 procedure where the implant is implanted into the jaw and a space is left for the abutment, so no secondary procedure is needed, and it's subperiosteal. And then for implants and bridges, implants are much longer lasting, and they lead to little to no bone or gum loss, which is significantly better than the bridges where there can be bone and gum loss.
Thank you. Any questions?